All right, so let's talk about perineal massage. And for me as a midwife, it's kind of hard to talk about perineal massage without, again, framing it in terms of exploration. So if you've watched the videos about pelvic floor where we've talked about sex, if you've watched the videos on return to fitness, I think this will really click. And it's also the kind of thing where you might find yourself going back and forth a bit and then things click later on. But basically, not everybody needs to do perineal massage. In the C-section scar massage video, I say the same thing. This isn't something everybody needs to do. If you're feeling fine and good and using your vagina and not having a problem, you're fine, okay? You can do it if you're just interested in understanding where things are at for you, for sure. Exploration is always fine. But let's assume right now that I'm talking to those of you who had a tear or an episiotomy, and you are past your 6-week visit, you've had confirmation that you are healed, and you maybe feel a little bit of discomfort or a lot of discomfort with sex, or even some things that have to do with just moving your body, but mostly sex, right? What I want you to do first is explore. And that exploration will quickly turn into some investigation that turns into working on those tissues a bit. So remember that scar tissue just doesn't stretch the way tissue that's never had a tear or a cut in it would stretch. And so what we're trying to do is bring back some healthy blood flow and bring some flexibility to those tissues. So I'm going to use this part of my hand as like a model perineum. I think it's pretty good looking model perineum, okay? So the first thing I want you to do is get comfortable, right? You're gonna get comfy, usually in a semi-reclined position in your bed. I want you to have clean hands, and I want you to have some sort of lubricant close by. So that could be coconut oil, it could be olive oil, it could be a lube that you've bought in the store. I really like silicone-based lubes because they don't kind of get sticky and dry out from the air, but your choice, explore. The first thing I want you to do is kind of just on the outside, actually, right? So imagine that you have a little bit of a tear or a cut or a scar. I mean to say here, first thing I want you to do is not be so worried about working your way in, but like really just finding it. Because, right, if we tear, especially if we tear rather than a cut, it can be curved or off to the side, as can an episiotomy. But it's not necessarily always just like straight up and down. So I think sometimes people kind of get lost. They don't know where they are. So you're kind of like looking for where you feel a little bit of knotty thickness, where that scar might be. And just for starters, find it. And then with just a little bit of gentle pressure, work your way around it until you don't feel it anymore, right? You're going to be moving closer towards your rectum as you do this, but again, it could be a little off to a side. Some tears start sort of on the inside and then work their way out and down. So go in both directions and find the limits and the edges of this and just explore and see what you feel. I don't want you to feel anything that makes you grip your muscles, that makes you hold your breath, or that makes you make noise, because as a tool for managing discomfort, the way we might in labor, right, use our voices to manage discomfort. I want you to be able to exhale and relax, especially your glute muscles, right? Like really letting those go while you're doing this, okay? So once you have a sense of where things are and what it feels like, you're gonna work at that pressure that you might call like a 2 to 3 tops on a scale of 1 to 10 in terms of discomfort or pain, but I want your brain to recognize it as pressure more than pain, okay? So once you've done that, now we can think about working inside and seeing what happens, right? Because tears don't just happen down here, they happen along usually the posterior, meaning the back side of your vaginal wall, so the side that's closest to your rectum. So when you go inside with one finger, you might feel a continuation of some of that scar tissue, right? So you're going to do the same thing, kind of feel your way around that and learn what's going on there. And once that's okay, you might move to 2 fingers, right? Because 2 fingers gives you a little more control over the situation. You could add a little bit more pressure. There's a way in which you can press down on those tissues, right? And I kind of want you to think about the inside of your vaginal wall, that posterior vaginal wall. I want you to imagine that there's a tic-tac-toe board kind of drawn. So there are kind of like 9 spots, right? And if you're in the first section of spots, that would be like your finger pads above your first knuckle, right? That second row would be like your second knuckle in, and the third row would be here. Maybe a little bit less than that even, right? It doesn't have to be so deep. But I want you to think that there's now from left to right, right? So there's a middle, and then there's off to the side, and then there's off to the other side, right? So it's like those 3 planes, this way and this way, right? So now you have a frame of reference of the places that you want to apply some pressure with your fingertips and figure out what you feel. And if you feel some tenderness, some pressure, something, sometimes it feels a little pokey actually, which is so shocking because it's like, you know, you're not poking yourself, but your brain can get this information that's like, ow, I kind of feel like something sharp is there. But what you want to do is kind of press into whatever you find really gently. Exhale, check in with your body, see if you released all your muscles. And that slightly negative sensation that you're not letting get too intense should slowly pass. And once it passes, you're like, okay, I'm going to move on. So now you can find another spot, right? And if you would just imagine that there's about 9 spots, you've done a pretty thorough assessment of yourself, figuring out where you've got some tightness. Now, what I didn't say in all of that is that I started out talking about scar massage, and then I kind of segued into just kind of like exploring all the places that could get tight muscularly, even if there's not a tear involved. And those things are kind of related, right? We want to know what our muscles are doing. When we've given birth, whether we have a vaginal birth or a C-section, some people get into a little bit of a gripping pattern, right? Our logical brain says, oh, things feel weak. If I just squeeze up real tight, I'm going to get it all back to normal. And then our bodies can get used to holding that way. But when we're holding tight, we lose some of the flexibility and give in our pelvic floor. And we need that just as much as we need strength, right? So that's why we want to figure out if there's anything else going on beyond just scar tissue, right? So this can be useful for people who have had C-sections or people who had vaginal births but didn't tear, and people who may be experiencing sensations of pressure, a feeling like they might leak or are leaking, right? So now we're talking about people who might be on the spectrum of pelvic organ prolapse or stress urinary incontinence. These are common things that people experience, and kind of just understanding where you're at and seeing that you can make some improvements all on your own is so huge, right? Now, all of this is not to say that I want most people to see a pelvic floor physical therapist and get some really good information from somebody who is truly skilled at doing a really full body assessment, because your whole body's involved in this. But I want to give you the power to figure yourself out and see where you can make some improvements in the situation. And if you see progress happening from this, fantastic. So this is the kind of thing that you could do for a few minutes every day, a few minutes every other day, completely unscheduled and random. Any amount of checking in might bring you some progress. If you're looking for progress, you might want to be more consistent. But that's just a great starting point. So if you need to talk about this some more, feel free to make an appointment with me or with Dr. Mel to learn more about where you're at and wrapping your mind around this. And we can both help you find people in your local communities if what you need is a pelvic floor physical therapist. Okay, hope that helps.